Good afternoon and welcome to my collaboration and leadership reflection video. This is for the Nursing 4010 Assessment 1. My name is Colleen Findura. In this video, I will reflect on interdisciplinary collaboration, not only personally, but as noted in the scenario that was given. I will note ways in which interdisciplinary collaboration can be successful or unsuccessful in achieving desired outcomes. I will identify how poor collaboration can result in inefficient management of human and financial resources and identify best practice leadership strategies from cited literature that would improve the interdisciplinary team's ability to achieve its goals and work together. Over the years as a nurse, I have experienced many interdisciplinary collaborations. One experience that I had was at the facility I am currently employed. Technology has become a staple in the healthcare field, and with poor collaboration, new technology integration can result in inefficient management of human and financial resources. Scanning medications into the electronic medication record was the new technology that was integrated in my facility. With a successful integration, this new technology could potentially decrease medication errors. The process was a transition not only for nurses, but the physicians, the pharmacy, and the IT departments. The physicians had to order the medication in the electronic health record. Pharmacy had to prepare and label that medication appropriately. The IT department had to make sure the labels and the ID bands scanned correctly, and the nurse had to know how to scan the medication before giving it to the patient. The idea was to make sure that the right medication was given to the right patient. In the scenario at Villa Health, the process of transitioning to the electronic health records was presented much like my experience of transitioning to the medication scanning. In both instances, the goals was to increase patient safety and in turn decrease the healthcare facility's financial burdens. Medication errors and patient safety can potentially cost healthcare millions of dollars. The facilities must also consider the cost of the new systems. There is potential for them to fail and to end up costing the facilities more than what it could potentially save. That is why having good interdisciplinary collaboration is so important to have a successful outcome. Both instances of my personal experience and that of Villa Health integration require collaboration of teams within the facility. At my facility, physicians, pharmacists, IT members, and nurses made up the collaborative team. A leader was chosen from each group. Each one brought their expertise to the team. Having a representative made it easier to understand each other's roles, which builds a foundation for trust. Trusting your collaborative team can be a challenge, but with everyone setting the goals of successful in developing a plan on how to integrate the scanning system, there is a better chance that the scanning system will be successful. With this new integration, there were steps that were taken to have a successful outcome of the medication scanning. Before going live, meetings between team members occurred. Nurses, pharmacists, physicians, and IT all discussed how the integration should occur based on each one's suggestions and input. During interaction and collaboration, professionals learn from each other. Quote, effective interpersonal team-based care is critical to enhance the delivery of efficient care, reduce healthcare costs, and improve patient safety and outcomes, unquote. Constanza, 2015. Quote, this workplace learning, the acquisition of new skills as an individual or as a team, can lead to a new way of functioning, unquote. Rycroft Malone, 2015. In the scenario at Villa Health, there was no collaboration with team members from upper management, the manager of the facility, the IT department, and the nurses. Poor collaboration can result in poor outcome of a new integrated system put in place by the company. Quote, effective interpersonal collaboration or interprofessional collaboration, teamwork requires mutual respect, trusting relationships, effective communication, and a shared understanding of each team member's role, responsibilities within and across the team members, unquote. Baker, Gustafson, Benbow, Solis, and Barks, 2005. This was a major factor in the lack of success integrating the new system. In the facility I work at, it made the transition easier with good interdisciplinary collaboration. At Villa Health, the professionals involved with the transition stated that they were not consulted about how the transition was to be integrated. They did not have a mutual respect and did not have effective communication. Quote, to have a successful collaboration, interpersonal teams require intentional effort to enhance collaborative relationships and pursue shared goals, unquote. Baker, Gustafson, Balbin, Salas, and Barsh, 2005. Quote, collaborations for the leadership in applied health research and care, which I will refer to as the CLAHRC, is a collaboration between the healthcare services and higher education organizations who researched the gap in evidence about the collaborative approaches to bridging transitional gaps, unquote. Constanza, 2015. In researching the literature, the CLAHRC listed methods that will help improve interdisciplinary teams' ability to achieve their goals. These include the following. Attention to communication mechanisms, found in paragraph 11 and 12. Setting intermediate outcomes and goals, paragraphs 13, 15. Time and space needed to be given to develop and implement plans, paragraph 16 and 17. Choice of topic with resonance and relevance, paragraph 11. Closer physical proximity between partners, paragraph 11. And rebalancing and sharing power, paragraphs 18, 19, and allowing time to develop mutual trust and respect, paragraph 18 of Constanza, 2015. In implementing the new medication scanning at my facility, communication was the key. There must be transparency between all the teams so that each one knows what the other team's roles are in achieving that final goal. There were meetings to bring all the teams together to accomplish this. Setting intermediate outcomes/goals can be a mechanism for evaluation and learning across the collaboration. In the first meeting, a short-term goal of assigning super users, who were the senior leaders, was implemented. Each team would supply an individual that would contribute to the education, evaluation, and implementation of the new scanner system. Quote, we have found that leadership models are extremely helpful for learners to grasp new concepts, make sense of lessons learned through their experience, afford structure that facilitates lasting comprehension through reflection, and provide a basis for learner assessment and program evaluation, unquote. Hargett, 2017. This will facilitate resilient collaborations and sustainability activity, particularly in contexts that are in a constant state of flux, like healthcare, as stated by Constanza in 2015. Each short-term goal needed time to develop and to be implemented. Assessing the short-term goals helped to be able to readjust the plans to continue to the correct path of the final goal. Having the members of each team understand the resonance and the relevance of the project helps to ensure a successful outcome. Each team has their specialty, but need to understand all the other team's roles to be effective. With a full understanding of what is to be expected, they can develop a sense of trust and respect. In the study that CLAHRC published, they found that this is important for success. A closer proximity between partners is also an important step of rebalancing and sharing power, allowing time to develop that mutual trust and respect. All of these previous mentioned steps were conducted at my facility, from the first meeting to the actual live integration of the new scanning system. A super user was available to all staff members to troubleshoot any unforeseen problems and help individuals be successful and feel confident about the transition. Due to all these positive and interpersonal collaboration, transition to the electronic medication scanning was successful and continues to grow better every day. Looking back and reflecting on the practice of integrating disciplinary collaboration strengthens the fact that it is extremely important. Communication was imperative. In the future, coming together for a common goal will require a positive interdisciplinary collaboration. Unfortunately, in this scenario, it was the complete opposite. They did not start with a collaboration with all the teams involved. there was no communication between the teams. The IT department was not involved in any of the decision making as far as even choosing the program that would be implemented. The staff was not given any information about the plans, and the manager was caught in the middle between the company and the other team members. At no time were there any clear goals or any intermediate outcomes that were set. The new system was just started, and everyone was expected to be able to figure it out and to make it successful with no prior knowledge of the system. Many of the team members did not see the relevance of the new system. The nurses felt that they were better off using their old methods and felt that the new computer system caused delay in patient care, and which would be harmful. They would rather continue to do it their way than to risk any harm to their patients. The lack of knowledge also caused ill feelings between the teams. Instead of bringing the teams together, preferably in a close physical proximity, each team member was basically on their own to work out the new system's problems. As I illustrated in this video, several factors make up a good and bad collaboration, but it takes all the pieces to come together. I demonstrated how interprofessional collaboration in both my own personal experience and at Villa Health has factors that can determine the outcome of the new systems. In conclusion, interpersonal collaboration can be a make or break factor in how successful integrating a new system can be. Thank you.